If I told you that a medication millions of men take every single day could quietly be shutting down your erections, would you believe me? I'm Dr. Amara Cruz, board-certified urologist with over a decade helping men restore their confidence. And today we're exposing 3 incredibly common medications that recent clinical studies link directly to erectile dysfunction. Here's what shocked me. Medication number 2 is so common that there's a good chance it's in your medicine cabinet right now. But here's the critical part. There's one mistake men make when they discover this connection, and that mistake at the end of this video is what determines whether you fix the problem or make it permanently worse. Before we dive in, drop a comment and let me know where you're watching from. Hit that like button and subscribe because this information could save your sex life. Now here's what you need to understand. Erections require perfect coordination between your blood vessels, nerves, and hormones. And certain medications disrupt this delicate balance in ways most doctors never explain. Let me show you exactly which medications are sabotaging you and what to do about it. Here's what you need to understand about how medications sabotage your erections. A normal erection requires 3 things working perfectly together: healthy blood flow, balanced hormones, and functioning nerves. When you're aroused, your brain sends signals that relax blood vessels in your penis, allowing blood to rush in and get trapped, creating firmness. But certain medications disrupt this process in 3 critical ways. First, they can reduce blood flow by constricting your blood vessels, making it nearly impossible for blood to reach where it needs to go. Second, they interfere with nerve signals between your brain and penis, so even when you're mentally ready, your body can't respond. And third, they can lower testosterone, which kills your desire, and without desire, getting firm becomes extremely difficult. Now here's what shocked researchers. A major clinical study found that men taking prescription medications were significantly more likely to experience erectile dysfunction, even after accounting for age, weight, and other health conditions. This wasn't just correlation because advanced analysis confirmed these medications weren't just associated with ED, they were likely causing it. So let's count down the 3 biggest culprits, and I guarantee at least one is sitting in your medicine cabinet right now. Medication number 1 is beta blockers like atenolol, commonly prescribed for high blood pressure and heart protection. These medications work by slowing down your nervous system, which effectively lowers blood pressure and protects your heart. But here's the catch. That same mechanism prevents blood vessels in your penis from relaxing and opening properly, which is exactly what you need for firmness. Clinical data shows roughly 1 in 4 men taking beta blockers experience some degree of erectile problems. The irony is, you're taking this medication to protect your cardiovascular health, which is critical for erections, but the medication itself undermines the very function it's supposed to support. Medication number 2 are statins, like simvastatin or atorvastatin, which millions of men take daily to lower cholesterol. These are among the most widely prescribed drugs worldwide, and they're highly effective at preventing heart attacks and strokes. But here's what most doctors don't explain. Cholesterol is the raw material your body uses to produce testosterone. When you aggressively lower cholesterol with statins, you can inadvertently crash your testosterone levels, which directly kills libido and makes achieving firmness extremely difficult. Now, this typically only happens at higher doses, but it's more common than you think. The tricky part is high cholesterol itself causes erectile dysfunction, so you're in a difficult position where both the condition and the treatment can hurt your performance. Medication number 3 is metformin, the go-to drug for type 2 diabetes management. Now, this one is complicated because diabetes itself is a leading cause of erectile dysfunction, with nearly half of diabetic men experiencing problems. But research indicates metformin may create additional risk beyond the diabetes itself. First, it interferes with vitamin B12 absorption, and B12 deficiency damages the nerves responsible for sexual response. Second, it may suppress testosterone production, which compounds the problem. So you have a situation where the disease causes ED and the medication treating that disease may make it worse. Now, before you panic and throw away your medications, listen carefully because that would be extremely dangerous. The conditions these drugs treat, high blood pressure, high cholesterol, diabetes, are far more life-threatening than the sexual side effects. Uncontrolled diabetes causes permanent nerve damage, leading to irreversible erectile dysfunction. Untreated high blood pressure leads to strokes, and unmanaged cholesterol causes heart attacks. These medications are literally keeping you alive. But here's your action plan. First, talk openly with your doctor about sexual side effects because many alternatives exist that work just as well with fewer problems. For cholesterol, different statin formulations or dosages may eliminate the issue. Second, optimize your lifestyle aggressively because exercise, healthy eating, quality sleep, and stress management improve sexual function dramatically and may allow you to reduce or eliminate medications entirely. And third, monitor your testosterone levels because if the medication is suppressing it, treatment options exist that can restore both your hormone levels and your performance. Now, the critical mistake I promised. Most men discover their medication is causing problems and simply stop taking it without consulting their doctor. This is incredibly dangerous and can lead to stroke, heart attack, or diabetic crisis within days. Your action plan is simple. Schedule an appointment this week and have an honest conversation with your physician about alternatives, dosage adjustments, or treatments that counteract sexual side effects. If this opened your eyes, smash that like button right now and drop a comment. Are you taking any of these medications? Subscribe for more men's health strategies and share this with someone who needs it. I'm Dr. Amara Cruz. Your sex life matters, but staying alive matters more, so never stop medications without medical guidance. Stay strong, and I'll see you in the next video.